Hello, everyone, and welcome to another episode of Beyond the Superficial. We are chiropractors and functional medicine practitioners at Synapse Center for Health and Healing, located in Eagan, Minnesota. Information shared in this podcast is not intended to diagnose or treat any medical conditions. Please consult with a primary care provider before engaging in any new activity or protocol. With that in mind, let's dive into this episode.
Hello, welcome to Beyond the Superficial here at Synapse. We're all the doctors, the female doctors here in the clinic. My name is Dr. Amber Janetsky. I'm a chiropractor and functional medicine doctor here in the clinic.
And I'm Dr. Ashley, also functional medicine and chiropractor. I'm Carrie, health coach.
Dr. Ellie, chiropractor and nutrition hormone nutritionist.
Jenica, a health coach here as well.
Awesome. All right. Well, today we're talking about preventative health care and why it's so important to get it and what we do at the office here to help you with that. So we have some questions that we're just going to answer along and hopefully it gives you some answers.
Great. Yeah, so I really want to talk about what it really means and how you can start applying it when we talk about preventative medicine and care. And so from a functional medicine perspective, what does preventative medicine really mean?
I'll start simply put, is we are trying to keep people from getting sick, having to go to the medical doctor, because we're grateful for when we have to go to the medical doctor and it's there, but we're just trying to prevent illness. That goes from mental illness to chemical problems with your chemistry, problems with your body. So we look at the whole person here to try and just keep things running smoothly.
Or even I think of physically too, we're chiropractors too, so coming in maintenance. Getting the muscles firing, doing what it needs to do, joints moving before, something does get out, strengthening the body, working ranges of motion safely before you get injured, just training for everyday life.
Yeah, when my patients that come in regularly for adjustments, their bodies are completely different compared to people who come in and wait 4 to 6 months. I have to work so much more on those patients to get the muscles to release and get them kind of back in order. And that's when injuries, and then once you get an injury, it takes a lot longer oftentimes to get better versus if you're up on it, it might only take 1 or 2 visits with me to get back in to feeling good if you do get injured. So it's a big one.
I even think from a nutrition standpoint, patients will come in and they think that they have an autoimmune disease out of nowhere, or, I have this weight gain out of nowhere. And it's, it's obviously not. It's been brewing for a really long time. When you're younger, your body tolerates and tolerates and tolerates. And eventually, if you keep assaulting it, it doesn't tolerate anymore. So it's really not out of the blue. And I think prevention, even we do thermography here, which I love, which is a thermal camera that can see inside of your body. So that's what I do instead of mammogram. But I make sure that all of my organs are in there so that if something were off, say my pancreas or my liver or something, I'm catching it way, way, way early. I think that's a big piece of preventative medicine. And we'll talk later a lot about labs and such, but realizing there's themes or trends happening in our blood work that we never look at in our 20s and 30s. And so then by our 40s and 50s, when they're off, you think it just happened, and it didn't just happen.
Yeah. And that's the difference with functional medicine lab work and medical lab work. When you come to see us, we're looking at those above and below optimal ranges because we want to catch something before it becomes a problem, before it's in the medical highs and lows. Yep. And so you're just going to get a different response from us, instead of just your labs are fine. Well, no, you're starting to trend in the wrong direction here. Let's course correct this and get it going in the right direction so we don't start developing those other issues.
Yeah. Or sometimes on that note too, a lab, let's say liver enzymes are slightly high. Sometimes medical doctors, since nothing is actively happening, will be well, we'll just watch this. That's where we come in is let's do something about it now.
And just because we have different tools in our tool belt, they wouldn't want to give you really hard medication just because it's slightly elevated. That's not warranted. But we have the supplements and nutrition that is warranted when it is just minor.
I always tell my patients that too, because they're like, oh, medical doesn't do anything. It's really unfair to put that on them, I feel like. Like, their job is very different than ours. Their job is to keep you alive in most cases. And so that's when you go to them. And that's when I've been grateful, like, oh my gosh, I need to go to the ER, or like, I need this. I do need this medication now. But it's really unfair to say that they should be treating you for the wellness side of things too, because it's just not their training. And that's where we come in. Yeah.
Not ours either, right? Like, acute care is not the same as preventative medicine. And so I think people forget that too, and they come here of like, well, we don't want to go there. Well, it's like, well, we have to utilize each expertise and specialty to its best ability. So
That would be great if we all work together, right?
Yeah,
We're going towards that.
Yes, I love that. And Dr. Ellie, we were talking about weeks ago that if women knew that before they get pregnant, or even like right after they have their baby, pelvic floor health is so important. Well, I never thought of that. And so then you get to be in your 40s and 50s and you go, what the heck is going on? Well, if we didn't address that right after we had our babies.
Yeah.
Right?
Yeah, that's very true. So every woman who's had a child should see a pelvic floor therapist. So that's what my specialty is here. And it's basically like going to surgery, getting your shoulder replaced, and never having PT after. Like your body needs to be retrained on how to work properly. And it's starting to become a lot more of the standard, which I'm happy about, but it's not there. So if you are in your 50s, or even 30s, and you have pelvic floor dysfunction, and you're like, but I had a child, so that's normal. That's not normal. So that is working before you're pregnant and after you're pregnant is a huge preventative with your pelvic floor, so that when you're 80, you don't go to the bathroom on yourself.
Right. Yeah. And we were talking too on just mental health too. Like, we have Ellie here. Other than Dr. Ellie, we have Ellie here who also does therapy and the stuff with trauma. It's not a great time to start working on mental health when you already have depression. I mean, yes, you do, but it's so much easier to do preventative care before you get there. So if you do happen to get depressed, you're like, you know what? I already know that I need to exercise to get better. I already know that I have to eat better to get my brain functioning better. But if you wait till, and I have so many patients who are actually active depression, it is so hard to get them to start exercising because of how they feel. But if you know and you practice those skills beforehand, so much easier to get yourself out of it if it does happen. So it's another preventative, and Ellie can help with some of that here too.
absolutely. Yeah. So talking about kind of lifestyle foundations, then getting into that of what we can do. If you had to pick three daily habits that can lower a woman's risk for future health problems, you named some of them, but what would be those 3 daily habits?
Sleep.
That's what I would say.
Move your body. Exercise is one of the foundations that if you don't work out or you don't move your body, nothing else will stick. You have to move your body. And I know it's unfortunate. A lot of people don't like it. But once you grow to like it more and more, it starts to compound on itself. We just found this research paper talking about how the gut biome can actually change when you work out, promoting you to enjoy working out more. So once you get started and you grow it, it not only just helps your physical body, but it helps your chemical body in every way possible.
Yep.
And emotional. It's mental, chemical, and emotional. There's a lot of
Yeah, from a functional medicine or functional neurology standpoint, you're speaking my language. It's my number one thing is exercise, moving. When you move those proprioceptors, you're activating your frontal lobes, and it just helps so many things. So yeah, exercise is a big one.
So sleep, exercise, what else?
I'd say just be conscious of what you're eating and putting in your body.
nutrition, healthy whole foods, getting variety in. I think
It's diving deeper, I would say fiber, getting fruits and vegetables, and prioritizing different types of fibers. Really getting that gut as that foundation strong will really help you conquer any disease so much easier.
Oh yeah.
And I think fiber too plays a role in when we deal with the hormone fluctuation of women too. Like as we age and go through that too, I see a lot of up and down with bowel movements, and so fiber can play a really positive role in that as well. So
yeah, and protein. We've talked about protein in earlier podcasts and how important it is, and I wish that I would have prioritized protein earlier than what I did, but we need it for so many processes of the body. It's not just your muscles.
I think it's interesting that we all kind of picked the three same ones of all the things
Yeah.
that we can talk about, you know, that those are kind of the three. So it's interesting.
It is.
Yeah. What are some things as far as sleep that you would tell a person to prioritize specifically for sleep? I know we talked a little bit more about movement specifically and nutrition specifically, but anything with sleep?
So being consistent, like getting to bed, 9:30, 10, like just like having a routine instead of on the weekends, I'm gonna stay up till 1 all of a sudden.
Yeah.
So
Yeah.
just consistency.
Right. And sleep hygiene, really starts in the morning. So getting sunlight in your eyes in the morning, training your circadian rhythm, and then at night, not checking your email at, 9:55 and paying bills and, getting yourself ramped up or watching the news. I think try to do that earlier in the day. So you're not ramped at 10 o'clock, or even like get in your bed at 9:30, read an actual book,
Right.
Yeah.
and lights dimmer, and get your body prepared to sleep.
Yeah.
I think helps you to sleep, and you want to aim for 7 to 8, 9 hours. My body likes 9 hours, but that doesn't always happen in my
God,
life.
I wish I had 9.
I know.
I
I
don't-
wish I
right.
could get
I
it, but
can't.
that's I'm
can't.
optimal at 9 too. Yeah.
Yeah.
So anything else less than that is like watch out.
And newer studies are showing that women do actually need more sleep than men, just because of our hormone fluctuation. So if you find that you do sleep longer than your partner, that's normal.
Let us
And that's,
sleep.
yeah, let us sleep. Beauty sleep is a real thing.
It is. Oh my gosh. Yes, it definitely is.
All right. So now that we kind of have those habits in place, or at least a place to start in a sense when we talk about preventative care, what do we do on the lab test side of things? A lot of people come and ask and be like, well, how do you know where I'm at? And we can do lab tests. And so what lab tests do we recommend for early detection and prevention?
The number one that we typically run on all patients is a really comprehensive blood panel. That's just the most cost effective and the place to start, because if you miss some of these foundations, you're kind of like shooting yourself in the foot moving forward. So it just looks at things like blood sugar, how well you're managing that, your inflammatory markers like C-reactive protein, liver kidney enzymes, B12, vitamin D, folate, CoQ10. Iron ferritin is a huge one, especially for women, especially if we're starting to bleed heavier in perimenopause. Thyroid, advanced markers in thyroid, and then like bone health, ELK phos, also just looking at your immune system. And so it just helps us kind of look at, is anything off in just those simple areas that we can adjust and work on. So that's a number one that I would probably say we run on most patients.
Can you talk a little bit about what a full thyroid panel is?
Yeah, so typically we run like it's a TSH, free T4, a total T4, T3, free T3, reverse T3, and then TPO antibodies and TG antibodies. That's what our panel looks at.
Yeah, because TSH is just not enough to know what's happening with the thyroid.
Yeah, oftentimes, I mean, if I would have just ran a TSH on some patients, but we just miss that their antibodies are really high, it just gives a little bit more information about what's going on.
Yeah, and we look at the ratios too, because the ratios will play a huge role into your ability to, make the correct kind of T3, or you have a conversion issue. So those conversion ratios are super important as well.
I have other labs, but do you guys want to chime in?
I typically, since I work with hormones a lot, I use a Dutch test to look at hormones. And I love using that as a preventative, because women come in typically and they're like, oh yeah, my period's a little off. And, I am a little bit more moody around my period. Or yeah, I have really bad cramping. And in reality, none of that should actually be happening. Periods should be very calm. You can't have like a minor cramping, but your bleed should be normal. It shouldn't be extremely heavy. You shouldn't be having mood swings around your period. And so women think that that's normal. And so it's kind of preventative in that way of, fixing something that's standardized as normal. But in reality, we can change a lot of lives by just doing that lab test to see how their hormones are.
Yeah, what would that check for somebody looking at doing versus what they're going to get at a primary visit?
Yeah, so with the Dutch test, it's nice. So it's urine based. You send it at home, do it at home, and then you send it back. And then we look at the testosterone, cortisol, estrogen, progesterone. But then we also get to see how the estrogen is actually broken down. So there's 3 different pathways. Two of them are a little bit more proliferative or estrogenic. They kind of have more symptoms, and one of them is the healthy one. And so if your estrogen isn't broken down in the right way, you get a lot more symptoms, even though your estrogen in and of itself is within normal limits. So it's a really more of a deep dive into how your hormones are working and functioning even when they're broken down. We have tools to kind of shift it all and level it all out too once we find that.
And that's something that's different than if you could use serum. So serum we'll do if we're going to be doing like bioidentical hormone replacement therapy. Where the Dutch shines, I always tell people, is it shows those detox pathways. Like for example, for myself, I'm really, really high in the 16-OH pathway. And so, and I've also had a lot of fibroids, and that's one of the things that can be associated with. And so things like polycystic ovarian syndrome, fibroids, endometriosis, cancer, those things will favor different pathways like the 4-OH and 16-OH pathways that we don't see on typical blood work. And so that's why I love it too, is because like had I known, like you were saying, had I known that I favored that pathway, like maybe I could be doing some things like sulforaphane to help like detoxify that a little bit. Maybe I wouldn't have had so many fibroids. I don't know, but it's kind of cool that way. And it also shows different things with the polycystic ovarian syndrome, with the 5-alpha pathways that you don't see typically on blood work. And so it kind of can give us some clues into that too. So, but yeah, I love the Dutch.
Yeah, and even in terms of like preventative care, like as a woman is like going into menopause, like we want to make sure adrenals are really functioning highly before, you know, that brain or the ovaries stop, you know, producing all those hormones. So we want to make sure adrenals are up and running so it can kind of take over some of that hormone production. So I love it in that sense too for adrenal health and prevention.
And it's cool too if you, because a lot of women want to do intermittent fasting. Well, if we find that the adrenal glands are just tanked on a Dutch, I mean, I personally don't recommend doing intermittent fasting at that time because you're not going to be managing your blood sugar very well if your cortisol is just not doing well. So it gives us some good information with that too.
Love the Dutch test.
Yeah.
It's like an
Any others?
inflammatory marker.
So good. Any other labs?
And I guess like in terms of bone health, I like to order an NTX, and it's a peptide breakdown marker, CTX, where it shows us if you're breaking down bone. So instead of, you know, waiting to find out, oh, I have osteoporosis on a DEXA scan, like we can actually look at to what degree are you breaking down that bone, and then a collagen peptide to see, you know, how well you're building it. So it kind of looks at, are you breaking down? Are you able to build it in the first place, and what we need to fix there? So it's also a good preventative marker I like to run in terms of bone health.
And gut tumor or GI map. You know, I always learned in school for functional medicine that all disease begins in the gut. So if the gut's off, and off can mean so many things. If that's not, I mean, the gut can affect the brain, the gut can affect our mood, the gut can affect the obvious things, you know, with bowel movements, and bloating and gas and all of that, constipation, diarrhea, but also our brain and you know, how we feel overall is so much affecting the gut. You can't know what's going on if we don't look in there.
Yeah.
It'll show us even all of the digestive juices, I like to say. You know, what is your stomach acid looking like? What is your bile doing? Is your bile functioning? Is your pancreatic enzymes working? Do you have immune system in your gut working well? Is it tanked? Is it still working? Is it overworking? And why? You know, so it puts a lot of pieces together for us, and we can see all of that.
Yeah.
If everyone could just do gut tumor, a Dutch, the Vibrant Standard,
It's great.
There's a
organic
lot of
acid, we would get it all.
Because and I don't know, maybe you mentioned this, but just in case you didn't, the gut tumor, it does show if you have leaky gut. It does show with
I
the
didn't
Zyme
mention that,
and
yeah.
occludin. Those are huge because a lot of people want to know that. So it does show those markers, and it will show. It does look for parasites. Parasites are hard to find. They have to be shed in to get in the stool, so we don't find them very often that way. Just the balance of the bacteria. And also just opportunistic bacteria that might be growing, or viruses, yeast. So it just gives a huge picture of what we might need to work on to help that. So it's a great one.
Yeah, and like in terms of like, you know, preventative care too in the gut, that secretory IgA in the gut tumor, like do you have enough of an army to even be able to fight off an infection when it does come your way? So I also love that marker for that reason.
Yeah, because like what you were talking about, the gut bugs, or maybe it was you with the exercise. I mean, they communicate with you, like they make you crave certain foods. So I mean, they're just so important that's a great one to do for maintenance.
It's kind of crazy. The human body has more bacteria cells than it does human cells. So we have to take care of our bacteria because they are more of us than we are of us.
I get goofy with that because like it's just when you start thinking about that, it's like, who's in control here?
It starts. That's right. So kind of going off of the labs side of things, when we talk about preventative care too, a lot of times you can't get these tests run. Some of these are specific to finding a provider that's going to run them for you, and that might not include your MD or your DO or your NP or your PA. So we do them here, but not every place is going to run them, and that's just because, again, like, they're trained specialties and environments that, you know, we utilize these as preventative root cause medicine, that when you go in with something severe or immediate, or they're not going to have the time to run a dust test that takes a few days to do, a urine test, and then like 4 weeks to get results back. So things like that, things do take time in the functional medicine world. And so that I just want to note too, at time and money, it's a lot of times out of pocket. Insurance doesn't cover a lot of these tests either. So unfortunately, that's another reason why you don't see that a lot in offices such as, you know, your basic clinics or hospitals.
It's
So
worth it though.
yeah,
You save yourself money.
absolutely.
long run.
Like, we see all these benefits, and that's why we're sharing them too.
When investment in preventative is going to save you a whole lot of money in a diagnosable disease later.
And time and pain.
Yeah, time and pain and problems. That's it. I think that is really important, regardless of the financial side of things too. Is something to really consider.
I got a couple more tests.
Yeah.
Just in case you're moving on.
No, I was gonna move on.
Okay.
So
I just want to throw them out there. The other common one that I'll do, and I know you guys all do too, is a total toxic burden test. It's a common preventative one that people want to run just to see like what their heavy metals are looking like, what if they're being exposed to high amounts of mold toxins, and then if there's environmental toxins. Because then if you find that it's high, you can maybe find a source, eliminate the source. So you can help prevent just it continuing to cause problems. And then another thing that we can do too is if there is a cardiovascular disease risk increase, like if you have a family history of cardiovascular disease and you have like high lipid levels, we can do advanced lipid markers just to like assess your risk a little bit more. And so that's another common one that we can kind of go down, because there are certain protocols, supplement, diet, lifestyle changes that we can kind of, again, switch which pathway you're kind of going down to help prevent. So that's the goal.
Yeah, great. All great ones. And we have a wide variety of ones we can utilize.
Yeah,
We don't
there's
use those
so
for every
many.
single person that comes in. I don't
Food
want people to
allergies,
look up all the prices of all these and be like, oh, if I come there, it's going to cost me $1 million. No.
Right, no. We can get a lot from one, a lot of
Yeah.
information from one
Yeah,
test,
yeah.
right?
And we utilize your diet, your lifestyle, environmental factors, history to kind of go down a specific pathways for you, so we know what tests we might want to start with and utilize first and go from there.
And we don't have to run tests either. We can, like you said, go off of history and symptoms and create a plan that creates benefit without running expensive labs if we need to. Yeah.
Absolutely. Yeah. So now, as we adapt over time using preventative care for that, how should women think about it? What and how should women think about in their 20s, 40s, and beyonds when we think about how it changes over decades?
Yeah, I was even telling Dr. Ellie earlier, like, had I known what I needed to do for perimenopause, you know, in my early 40s, I would have changed so much about my lifestyle, but I had no idea. I also would have worn sunblock on my face earlier, on my lips earlier, and, you know, taking so much, you just take for granted that everything's going the way it's supposed to go. And I wish I would have realized all of the nutrition that was important in every single, you know, area of my life, or every decade, I guess, of my life. So in the 20s, we have nutrition, movement, and different screenings. Like, you're screening for different things in your 20s than you are typically in your 40s. You know, we're not doing STD treatment, you know, screenings as much, you know, 30s and 40s, 50s. But she told me that it's happening more and more in the 70s and 80s and the in the nursing homes, but that kind of made me laugh. But so, and then stress management and sleep, learning those things, and then learning the effects of excessive alcohol, what happens when you are drinking heavily in college or whatever in your 20s, that's going to set you up for a lot of problems later.
Right.
Yeah.
And you guys can talk about 30s and 40s and whatever.
Yeah. I mean, the Dutch test, Dutch and serum hormone testing would probably be the thing that gets changed in your mid 30s to early 40s and up, that you can catch it early, because once the bone loss is gone, it's hard to get it back. And once there's cognitive changes, it's not really coming back. So if you can be aware that these changes are happening 10 years prior to menopause hitting, then if we can kind of start doing preventative care, then that's a big key.
Kind of going off of that, for perimenopause, a lot of women don't know that you can start bioidentical hormone replacement therapy with the first symptoms of perimenopause. And that makes the transition so much easier. So getting on estrogen, progesterone, or testosterone right away really makes that glide so much smoothly and saves your bone, muscle, brain health at a greater rate than if you don't take it right away. So the second I have perimenopause symptoms, I'm going on bioidenticals.
We're already there. We've got Rochelle here, who's our PA, who's a fantastic and knows her stuff when it comes to bioidentical hormone replacement therapy. So we can provide that here.
Absolutely. And I also want to just emphasize with the bone health, there's a lot of research out there about getting DEXA scans earlier than recommended, because they recommend them very later on when the bone loss is already there or not there, and how getting a DEXA scan in your 30s before menopause to see, keep getting check-ins to how your bones, that bone density is changing, has been kind of like the new thought and kind of the preventative side of things. I know we talked about that already, but something to consider in your 30s when you start that like perimenopause or before then, to really know kind of what your body is doing. So you have a heads up, like, hey, am I already starting the process right now? Or what is my bone density now? Because we don't know that there's a big area that happens in menopause, pre and post. And so we don't know exactly, how it's going to affect everybody or to what degree by the time you actually get the recommended DEXA scan. So how do you know what it was like before then or after then, or, where that biggest change happened? You don't. Something to think about.
Well, I think dialing in your nutrition in your 30s, making sure that your hormones if you're having problems with your hormones in your 30s through your 40s, chances are you're going to have trouble in perimenopause in your late 40s. And getting your nutrition dialed in, like we talked about, fat, fiber, protein, so your hormones are healthy, but then so that your blood sugar is not out of whack. I know as soon as my estrogen started dropping in perimenopause, my blood sugar kind of went crazy. I'm like, why am I having blood sugar drops? I never had blood sugar dysregulation ever in my life until my estrogen changed, and just like how my body composition was changing out of nowhere. I changed nothing, that's the problem. I changed nothing transitioning from 30s to 40s into 50s. I didn't do anything. So I'm like, I don't need to change anything. Everything's fine. Well, it was. But once your estrogen drops, progesterone drops. I don't sleep good. I was hot sleeping all the time. So I'm definitely a fan of HRT, but blood sugar dysregulation, in your 40s is kind of setting you up for a lot of weight gain and dysregulation in blood sugar in your 50s.
Yep.
Good ones. Any others?
I guess like one thing that popped in the brain too while you're talking about bone health was resistance training, like starting young, 20s, 30s, like really putting on that muscle. So then like when you are a bit older, hormones do start dropping, like you already have like all that muscle mass protecting your bone health and just stabilizing blood sugar too, utilizing blood sugar properly. Like muscle mass is so important. Like start as soon as you can and carry that out through like you shouldn't be scared to lift heavy weights in your 50s, 60s, even 70s. Like do what you can. Don't be afraid to lift heavy.
It's important for lymph health too, moving lymph and detoxifying. It's a big thing too.
Yeah, I think just in general, what I'm thinking of things that we see a lot of people for, eventually at the point where we still see people with issues like current issues, right? So there might not be preventative, but keeping them from preventing, further disease or illness. So just because you might have something going on chronically doesn't mean you can't see us.
Yeah,
But
good point.
Also, too, with that, things that I feel like we do see a lot of with women, along with hormones and bone health, is the thyroid. So a lot of times, if they're not getting those extensive panels, they'll fight to get those extensive panels run and have things looked at, or a provider that will look at those and know how to interpret a whole panel of thyroid tools. Because I've had a lot of just friends and family members too that have had to have thyroid removed, or even the thyroid cancer being on the rise. So just things to also help that, it's kind of well-rounded. There's a lot of full circle things that are related, which is thyroid hormones, gut health, and then bone health along with all of that. So just remembering there is a big picture look that we want to look at for those things, but getting those markers run so that you can do something about that now, and that goes along with all of the other areas. But that is one I feel like that has become popular, and people don't realize, like, I'm tired, or things have changed, or now the weight loss just started. I'm in my 30s, but I'm working a lot more and I'm not as active, and then all of a sudden it becomes 40s and you're like, well, I'm kind of hitting perimenopause, and then 50s and I'm like, well, I am menopause and then I'm post, so like where did it start? So just getting a foundation, just even our extensive basic type panel is a good place to start.
Yep.
Going off of that, a lot of that preparation and work applies in different areas of life too. So even like pregnancy prep. So we have a really good pregnancy prep program that if you do want to get pregnant, we have, nutrition protocol, IVs, we have acupuncture, we have a bunch of different ways to set up your body so that you can handle a baby and grow it really well. And then postpartum, you'll do so much better because your body isn't completely depleted of the nutrients, so that you can just get back to yourself faster too.
You have to start this way ahead of trying to get pregnant, but looking at that total tox burden, because you don't want to do a lot of detoxing right before getting pregnant, but years before. And that's where, like, we've talked about in other podcasts, looking at your toxin exposure in life. I mean, that stuff can be passed on to developing fetus. So getting rid of toxins in your environment, and maybe thinking about the total tox burden and just seeing what's going on. But that'd have to be, really thinking ahead.
Like a couple years or something.
Yeah, I guess I don't know the research exactly, like how long, I don't know if you do, but how long you should before conception be looking at that. But yeah.
The pregnancy prep itself is about 3 to 6 months. So you would want to do that before then. So
yeah.
probably a year and a half minimum, so that you
say.
have time, and then on to the next stuff.
Eliminate stuff, yeah.
So as proactive women,
Yes.
we're here for you.
Amazing. Great. So for listeners, if they could take one preventative step this week, I know we've talked about a variety of prevention methods and myths and things like that we want to address as well. But what's one step they could take this week to kind of get themselves to make some prevention movement and prevention in the area?
Well, we've got a great podcast series that you can follow.
Yes.
That can give you like certain little action steps each week that you can start incorporating. But yeah, I'd just be like, if you're just gonna pick one, just pick one and go for it, and just kind of consciously make a connection with, okay, how did this make me feel? Because if you can make that connection that, oh, I do feel better, that's gonna change your brain, and it's gonna help you be consistent with that change.
Yeah, I would say know yourself too. What step is going to be realistic for you? Some people really are science-based, so they're like, I need the labs. If that's the first step, find a place that's going to run some preventative labs for you. Some people are like, I don't have time for that. I just want to make a lifestyle change, see if it makes a difference. And that can be one of the things we talked about: sleep, movement, nutrition. So just really sit back, kind of know your extent too, and kind of decide what makes sense for you first, and then
Get outside, add more steps to your daily steps. Record your steps and say, I'm going to add 500 every once a week, whatever works in your life. I know it takes time, but add more steps, be intentional. Park your car farther. I have a treadmill in my office, and so when I can get on and work, if I sit all day, I'm so much more tired by the end of the day. Or if I'm walking throughout the day, or stop and do body weight lunges, once an hour. If you have to go to the office bathroom to do that, do that. Just get some movement in your body every day.
I think when it comes to prevention, it's those small baby steps that all add up. It's not like immediately starting to work out every day for an hour. Like
Right.
nobody has time for that. So it's those small little steps that really help with the prevention in the long term. So, start with something that you're going to be with consistent and then go with it.
Exactly. Know yourself. Know your
Yes.
Add one vegetable. You don't have to add 4 right
Yeah.
away. Add one.
Yeah, I love it.
Yeah, start changing your diet with your breakfast.
Yeah.
Make sure your breakfast is protein and fat and not full of carbohydrates. Start there. Start with your breakfast.
That goes into the myths really nicely in the fact that, like, what are some myths that I'd say it doesn't have to be hard. We can do these simple things that make huge changes. So that's one myth that doesn't have to be hard. Do you guys have other myths?
I feel like we touched on a lot of them throughout, of like things with primary, like that you get a doctor's office versus here, why we test. But yeah, I mean, the other ones that people bring up too.
I've got more.
So functional medicine is only about supplements.
Yeah.
Is
You
that
don't
all
have
we
to.
do here? No, definitely not.
No, this is a fun ending. I kind of like this.
Yeah.
Let's do the,
Okay.
the myth and answer. I like that.
Yeah, no, we can do just lifestyle diet changes. We can do it. I mean, obviously we're chiropractors. We're doing adjustments, which is huge in and of itself. So
Yep. What else? Functional medicine takes forever to work.
Body does take time. Like
Yeah,
hormones,
sometimes.
it's what typically like 3 months
4
minimum
months.
for
Yeah.
them to change. So
Mhm.
But we put people through a elimination diet when they start with us. We're checking for a lot of things when we do elimination diet, but even taking sugar out the first week is sugar, so you all know it's sugar. And people are like, "Wow, I didn't realize and how much better I feel." And caffeine, taking caffeine out, just try and see how you feel. People are amazed at how much better they feel just in one diet change. So it can go pretty quick.
Yeah,
Or
it can
giving
be
your body
easy.
what it needs. I have a friend that had struggled with Hashimoto's for a long time, and so her starting on selenium was kind of like a plant that's wilted and getting water. She just immediately felt so much better. So giving your body what it needs can be really quick, feel better.
My answer to that is it took your body a long time to get here.
Yeah.
So I'm like, how fast do you like if it took your body your whole life, like seriously, like it's every decision after every decision after every decision. It wasn't just like a one decision, most of the time overnight thing. And so it took your body a long time to get here. And not that it's gonna take a long time to get back, but give your body time and grace to go back and to all realign and restructure itself, and the chemical component to that, like it is, and the mental and the emotional component of that. There's a piece to that too.
Yeah.
I'm always so confused because I feel like conventional medicine also takes a long time too. Like if you're on Accutane, it takes 6 months to a year for it to work. And like instead of if you worked on your gut and you healed your gut, that would take 6 months to a
Or
year
your high
too.
blood pressure med or
Yeah.
right.
Antidepressants, you have to try a couple
Yes.
to find one. It takes up to like 2 to 5 years. People are still can't find the right antidepressant. So to find to find a true solution just takes time naturally. Nothing. There's no such thing as a magic pill in any sense of the word.
Yep.
Do you think functional medicine ignores medications?
Not if it's done right.
Right. When it's absolutely needed.
Yeah.
There's times like if you have type 1 diabetes, you better be on insulin.
Yeah.
You know,
And if you
so,
need
yeah,
thyroid-
absolutely.
If you need thyroid medication, you need thyroid medication. We
Right.
won't ignore that.
No,
here.
no. We want to work with it.
Yeah.
Yeah.
that's why I appreciate like our team here,
Yeah.
Rochelle and our NP. Like sometimes those things are needed. Like if we do have a strep infection, we just talked the other day. Like sometimes we do need to get on top of it so it doesn't spread. Like or like repurpose like pharmaceuticals like LDN and all these other great things that are out there that actually have benefits to the body.
Yep. We'll use them. Yep. I have a question. So it's not possible with my lifestyle to make these changes. Like I'm too busy, or I feel like that's a big myth. I mean,
Yeah.
I'm a single mom of 2 little kids, and I get my exercise in, I get my vegetables in, I get my meditation in. Like it doesn't take that much time once you get used to it. Once you get it into your routine. And again, maybe it's just 10 minutes of exercise, but it's absolutely possible. So I have a hard time when people say I don't have the time. Like, no, you have the time. It's possible.
Yeah.
Same.
Yeah.
Right. And
It is.
what are you doing instead of exercising? I mean, people aren't at work 24 hours a day. You're not sleeping 24 hours a day. You definitely have time. Being intentional, meal prep. I talk to people a lot about meal prep. Just prep on Sunday. You know, when I get home from work, I'm really hungry, and I have my lunch break, but I'm starved by the time I get home. I just think because I work out a lot, and by the time I come home, I'm just hungry. And if I didn't meal prep, I'm probably going to grab something I shouldn't be eating. Or if I had meat already made and something, you know, I put like the whole meal all together all the time. I mean, you can't always do that. I ran out of food this morning for that meal prep. So, you know, it happens, but prepping, it helps.
Just prioritizing that time.
Yeah.
The food doesn't taste good. I feel like that's a big, like, I love the food that I eat, especially when you start to get into it and you get good organic fruits and veggies. There's a huge difference in their flavor. And then just learning how to cooking and like the meals, like you just, once you learn how to do it, like I'm not going back, and your taste buds change, your microbiome changes. You start to crave certain foods. Like I can't stand sweets anymore. Like it's just like, ugh, it's too sweet. Like to get a Starbucks crafted coffee, like it's too much. So your taste buds change, and it doesn't take a long time. Like, you know, give it a month, give it 2 months, and things start to change.
It's 30 days, I think
to change the taste buds. Yeah, I believe it. So
that happens.
And you have to try a food 7 times if you don't like it. 7 times, that's the minimum, and then you'll start to like it.
Okay. Yes.
Just like putting some like seasonings, like throwing, like if you don't want to eat
good seasoning
ground turkey every day, like I just throw in like a bunch of peppers, chop them up, throw them in, add some salt. Salt makes everything better.
It does. And really, people will ask me that question a lot too about salt. And I say, if you are salting your own food with a good quality salt, I'm not concerned, because you're going to tell me it's too salty before like it's going to really be detrimental towards your health. Now, process is a different story. And that is mechanically made to make sure that it keeps you eating them, and you can't, it's taste by taste versus your meal. So if you're salting your own food, do it, make it taste good.
Good seasoning matters, and it can add a lot of good benefits if you're using good seasoning, which we can do another session on another day.
For sure. I, along with those, kind of like the time and energy, money is another one that's going to cost me a lot of money, or this is expensive, especially because I do a lot of our onboarding calls, and so people ask me, you know, like, I've heard this is going to be a lot, how much is this going to cost me? Well, people learn that along the way, and we are very transparent right away when you come in. We have you do a initial visit, not initial, it's called a practice member evaluation, at a discounted rate, so that you can get the overview of what it would look at cost-wise, so you can determine if you feel like it's a good fit there. That's a question or myth that we get a lot. I guess it could be a question or a myth.
But we do stay outside of it. Like, we don't work with insurance companies. We take HSA, but we don't work with the insurance companies because we don't want them to dictate how we test and how we treat.
And how much to charge you.
Well, and then I go to my medical doctor. I pay out of pocket. It's because of my insurance, my high deductible. I'm paying $300, $400 for that visit. I don't get much for that visit.
15 minutes.
And so like when you put into what you're getting here, like from the physical care with the chiropractic, with the nutrition, with the labs, it's in the holistic approach. Yes, it's totally worth the investment. And it might be that you have to save up some money and get creative, and then it's worth it though. Like it's,
even when it like comes to testing too, like we don't have to test everything under the sun right away. Like we can definitely take things in phases. Like let's fix your deficiencies first, let's fix your gut first, and then let's run hormones. Like it can be a step-by-step process to make it more affordable too.
Like that, and you're in control of it at this point. So like that financial piece, you are really in control. Like we want to give you your options, and just like what you said. And so I don't want to necessarily say like people are wrong, right? Like it's still an investment, absolutely. So it's not necessarily not a myth, but like there are things that we can do to help and also get you answers and get something out of the visit. All right.
I think that's it for the
day.
day.
Take a step forward.
Thank you
Thanks for joining.
That concludes today's episode of Beyond the Superficial. Thank you for joining us, and stay tuned for more episodes. For more information, please visit our website, www.officialsynapse.com. your partners in healthy living for optimal life. We would love to hear from you on how our podcast might be impacting your life. We also want to hear what interests you. Please leave your feedback on our media page at www.officialsynapse.com. Thanks again for listening, and we'll catch you in the next episode.